Good morning, wherever you are. This is Kai Lennox from ConferenceHype. From the July 2025 edition of JCO Oncology Practice, this journal review looks at teaching communication skills and developing comfort with difficult conversations, a combined palliative care oncology simulation session for hematology oncology fellows. Background: ASCO strongly endorses the integration of palliative care to improve outcomes and support patients in their cancer trajectories. Methods: we designed and piloted a didactic simulation session for each fellowship class, led by a faculty member who is dual board certified in medical oncology and hospice palliative medicine. Results: in year 1, 16 of 21 fellows completed pre- and post-sim surveys. Discussion: tools. From the August 2025 edition of JCO Oncology Practice, this journal review looks at daily patient-reported symptoms as predictors of unplanned healthcare encounters during chemotherapy, longitudinal observational study. Background: chemotherapy can cause symptoms that impair quality of life and lead to unplanned healthcare encounters such as emergency department visits and inpatient admissions. Methods: we recruited patients receiving cytotoxic chemotherapy for solid tumors into our 90-day study. Results: on days with moderate to severe symptom levels, the odds of having one or more UHE within 7 days were 4.53 times higher for vomiting, 2.84 times higher for decreased appetite, 2.5 times higher for shortness of breath, 1.76 times higher for diarrhea, 1.65 times higher for fatigue, and 1.58 times higher for pain relative to days with no to mild levels of that symptom. Discussion: specific daily symptoms were associated with increased risk of subsequent UHE during chemotherapy. From the September 2025 edition of JCO Oncology Practice, this journal review looks at defining the rates of cytokine release syndrome associated with talquetamab step-up doses. Background: talquetamab is a G-protein-coupled receptor class C group 5-member D T-cell engaging antibody, approved for relapsed refractory multiple myeloma. Methods: patients with RRMM who completed the talquetamab once a week or once every 2 week step-up dosing schedule between September 2023 and November 2024 were identified via the institutional database. Results: 50 patients completed the talquetamab step-up dosing phase during the study period. CRS occurred at a rate of 80%. Discussion: our findings suggested that the fourth talquetamab dose could be administered in outpatient settings given its high tolerability. From the September 2025 edition of JCO Oncology Practice, this journal review looks at survival after fertility-sparing surgery for early-stage cervical cancer compared with non-sparing surgery, a nationwide comparative study. Background: the oncologic safety of fertility-sparing surgery in young women with early-stage cervical cancer is largely based on retrospective data from small series, highlighting the need for larger studies to validate its safety. Methods: we performed a nationwide retrospective matched cohort study of all patients age 18-45 years with Fédération Internationale de Gynecologie et d'Obstétrique 2018 stage IA1 to IB2 cervical cancer who underwent fertility-sparing surgery, FSS, cone biopsy, large loop excision of the transformation zone, or tricholectomy, between 2000 and 2022 in the Netherlands. Results: in total, 1,446 patients were included, 482 treated with FSS, and 964 with a hysterectomy. 57.5% had stage 1A1 or 1A2, and 42.5% had IB1 or IB2 cervical cancer. Discussion: women treated with FSS had a significantly higher recurrence rate than patients who had the uterus completely removed. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X.
This is Conference Hype. Stay with us, coverage continues.
From the August 2025 edition of JCO Oncology Practice, this journal review looks at racial and ethnic disparities in receipt of guideline-concordant pancreatic cancer care among older adults in the United States. Background: patients racialized as Black experience a higher mortality from pancreatic cancer. Methods: patients 65 years and older with incident PC racialized as non-Hispanic white or racialized as NH Black or of Hispanic ethnicity were identified in the SEER Medicare database from 2004 to 2019. Results: of 12,772 patients included, 85.5% of patients racialized as NH white, 7.8% of patients racialized as NH Black, and 6.8% of patients were of Hispanic ethnicity. Discussion: approximately half of an insured population with PC receives GCC, highlighting a need to improve multidisciplinary access and treatment. From the July 2025 edition of JCO Oncology Practice, this journal review looks at unmet social needs among cancer survivors who were concomitant caregivers, a cross-sectional analysis of the Health Information National Trends Survey. Background: this study aimed to examine the impact of social determinants of health barriers, including food, housing, and transportation insecurities, on cancer survivors who also serve as caregivers, compared with cancer survivors only, caregivers only, and the general population. Methods: data were obtained from the 2022 National Cancer Institute Health Information National Trends Survey, which collected information on SDOH outcomes, including food, housing, and transportation insecurities, as well as participants' comfort level in sharing their SDOH concerns with providers. Results: overall, 49.1% of dual roles reported facing at least one form of food, housing, or transportation insecurities. Discussion: our study highlights the significant unmet needs of cancer survivors who also serve as caregivers, as they face higher levels of SDOH barriers than both the general population and cancer survivors only. From the December 2025 edition of JCO Oncology Practice, this is a review covering timing of immunotherapy in practice, feasibility and impact of morning checkpoint inhibitor administration. Immune checkpoint inhibitors are a core mainstay of cancer care. In routine practice, the time of day of administration of ICIs invariably is not stipulated in the clinical notes. Thus, treatment timing of administration is mainly dictated by constraints related to the organization and planning of the outpatient infusion centers, the clinical pharmacy, which reconstitutes the parenteral drugs, and the patients themselves. This is a good review on the topic, well worth reading in full in this issue of JCO Oncology Practice. From the February 2024 edition of JCO Oncology Practice, this journal review looks at impact of premedication de-escalation on incidence of infusion-related reactions with daratumumab. Background: daratumumab is an anti-CD38 monoclonal antibody used to treat multiple myeloma and light chain amyloidosis. Methods: a retrospective chart review at the Mayo Clinic reviewed eligible patients with multiple myeloma or amyloid light chain amyloidosis who received their first dose of daratumumab within the 4 months preceding the date of implementation, or no more than 4 months after the date of implementation on April 13, 2022. Results: nearly all patients received daratumumab by SC route of administration. Discussion: omission of premedications after cycle 1 of daratumumab did not increase the incidence of infusion. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X.
This is ConferenceHype. Stay with us, coverage continues.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the September 2025 edition of JCO Oncology Practice, this journal review looks at staff perspectives on normalizing and sustaining electronic patient-reported outcomes monitoring at 6 U.S. health systems. Background: we assess the perspectives of staff from 6 health systems to understand how electronic symptom management, an ECM program that supports patients during chemotherapy and after surgery, is normalized and sustained. Methods: starting in 2019, we integrated ECM into routine clinical practice and assessed its effectiveness using a cluster randomized step-wedge trial results. Of the 211 staff who initiated the survey, 169 completed it. Discussion: clinical staff reported moderate levels of normalization and capacity for sustainability. From the August 2025 edition of JCO Oncology Practice, this journal review looks at role of a designated pharmacist in reducing adverse drug reaction rates and preventing potential medication errors in hematology oncology, a randomized controlled trial. Background: evidence is insufficient regarding pharmacists' impact on reducing adverse drug reactions in oncology. Methods: this single-center randomized clinical trial was conducted at its outpatient hematology oncology clinics from July 2020 to October 2022. Results: the study included 182 patients, 91 in each group. Discussion: integrating an oncology pharmacist into hematology oncology clinics reduces ADRs and improves the detection and prevention of potentially serious MEs. Nova Quinn is covering JCO Oncology Practice. The topic is impact of a multidisciplinary approach to Lynch syndrome management on adherence to gastrointestinal screening recommendations. Background: the Jasinger Inherited Risk Gastrointestinal Clinic offers annual multidisciplinary care to patients with Lynch syndrome. Methods: a validated query of electronic health record data was performed. Results: before 2016, adherence was assessed from April 2016 to March 2025. Discussion: attending IRGI was associated with higher adherence to surveillance guidelines among individuals with LS. Talia Stone is covering JCO Oncology Practice. The topic is patient engagement with an electronic patient-reported outcomes tool evaluating hospital discharge readiness after cancer surgery. Background: patients undergoing cancer surgery often face complex, multidisciplinary needs related to recovery and discharge. Methods: we developed the G2D tool using a mixed results. Among 3,878 patients, the G2D tool had an adoption rate of 31%. Discussion: The G2D EPRO tool enhanced communication between patients and clinical teams, contributing to improved discharge planning and recovery. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X.
This is Conference Hype. Stay with us, coverage continues.
Grant Ivy is covering JCO Oncology Practice. The topic is implementation and patient-reported outcomes of an insurance-supported integrative oncology symptom management program. Background: while integrative oncology modalities are recommended for symptom management, few models describe guideline-supported or sustainable care. Methods: an IO symptom management clinic was established, providing individualized treatment plans through insurance-covered physician consults and massage therapy, low-cost group acupuncture, Reiki, and group medical visits. Results: between June 2023 and September 2024, 1924 IO treatments occurred among 291 patients. Discussion: this clinical model offers a potentially adaptable, hybrid insurance-based framework for effective, guideline-concordant IO symptom management care. Lena Park is covering JCO Oncology Practice. The topic is glucagon-like peptide-1 receptor agonists in breast cancer, metabolic, clinical, and survivorship implications. Background: breast cancer is increasingly recognized as an obesity-associated disease, with obesity linked to higher risk of postmenopausal estrogen receptor-positive disease and adverse outcomes across stages. Methods: adipose tissue dysfunction and chronic energy excess drives a tumor-supportive milieu, crown-like structures and macrophage inflammation, increase local aromatase and estrogen production, while elevated free fatty acids contribute to hyperinsulinemia and IGF-1 signaling with activation of Pi3K/ACT/mTOR and MAPK pathways. Leptin is increased and adiponectin reduced, amplifying proliferative and inflammatory cues. Results: standard breast cancer therapies can further worsen weight gain and insulin resistance, increasing symptom burden, reducing quality of life, and potentially compromising treatment delivery. Discussion: glucagon-like peptide-1 receptor agonists are highly effective agents for obesity and type 2 diabetes that improve glycemic control and reduce cardiovascular risk, prompting growing use in patients with breast cancer. Benji Cross is covering JCO Oncology Practice. The topic is advancing the oncology data paradigm, multi-site expansion of structured cancer data capture at the point of care. Background: incorporation of structured data elements within the electronic health record generates real-time data for many potential uses. Methods: a note-based data capture tool was developed to collect 5 data elements using minimum common oncology data elements language. Results of extending a data capture tool across multiple disease sites and practice locations. Discussion: structured data can be successfully collected in provider notes with 80% data capture. Miles Carter is covering JCO Oncology Practice. The topic is evaluation of the feasibility and safety of ifosfamide-based chemotherapy regimens for sarcomas in the outpatient setting. Background: ifosfamide is traditionally administered in an inpatient setting because of risks of neurotoxicity and hemorrhagic cystitis. Methods: This single-center study included patients age 18-60 years treated between 2018 and 2024. Results: the outpatient service saved an estimated 16.2 bed days per patient and 3.7 bed days per cycle. Discussion: these findings demonstrate that ifosfamide-based regimens through a structured outpatient model are both safe and reducing hospital resource utilization while maintaining treatment adherence and patient safety. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X.
This is ConferenceHype. Stay with us, coverage continues.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. Amara Saul is covering JCO Oncology Practice. The topic is SCRD Wars, clinical integration of emerging endocrine-directed and precision therapies in breast cancer. Background: despite therapeutic advances, breast tumors treated with definitive intent can recur, and metastatic breast cancer remains incurable. Methods: hormone receptor positive, HER2 negative breast cancer is driven by estrogen receptor signaling, and endocrine therapy, frequently combined with CDK4/6 inhibition, is a key treatment of endocrine-sensitive disease. Results and regulatory approvals are contextualized by outstanding questions surrounding the adoption of newer endocrine therapies. Discussion: multiple next-generation ER-directed therapies are being developed to overcome resistance and improve outcomes, several of which are entering practice. Diego Vale is covering JCO Oncology Practice. The topic is availability and use of social determinants of health data in Alliance gastrointestinal cancer clinical trials. Background: social determinants of health shape cancer treatment access, adherence, and outcomes, yet their collection and use within national clinical trials network studies remain poorly defined. Methods: participant-level data from completed Phase 3 trials for gastrointestinal cancers conducted by the Alliance for Clinical Trials in Oncology, or its legacy groups from 1999 to 2018, were pooled. Results: a total of 12,701 participants across 11 trials were included. Discussion: across Alliance and NCTN legacy group, Phase 3 trials for GI cancers, demographic variables have been consistently collected and frequently reported or analyzed, whereas SDOH-related measures are inconsistently collected and rarely published in the literature. Kai Lennox is covering JCO Oncology Practice. The topic is adoption of bevacizumab biosimilars in Medicare Part B, socioeconomic and geographic variation, 2019-2023. Background: oncology biosimilars have been promoted to reduce Medicare Part B drug spending, yet adoption may vary across socioeconomic and geographic contexts. Methods: we conducted a repeated cross-sectional analysis using Medicare Part B provider and service public use files from 2019 through 2023. Results: the analytic sample included 11,803 provider drug year observations, 93% located in urban zip codes. Discussion: from 2019 to 2023, bevacizumab biosimilars diffused rapidly in Medicare Part B, generating an estimated $84.5 million USD in aggregate savings, with per-administration savings exceeding 50%
Novaquin
is
by
covering
2023.
JCO Oncology Practice. The topic is real-world implementation of tarlatamab therapy for patients with extensive-stage small cell lung cancer and other high-grade neuroendocrine neoplasms. Background: tarlatamab, a bispecific T-cell engager targeting delta-like ligand 3 for relapsed small cell lung cancer, requires hospitalization and observation for 24 hours after the first 2 doses because of the risk of cytokine release syndrome. Methods: patients receive tarlatamab in the outpatient infusion center, followed by observation in an outpatient oncology immediate care center on-site to complete the 24-hour monitoring for CRS and immune effector cell-associated neurotoxicity syndrome. Results: from June 2024 to September 2025, 49 patients with SCLC were treated on the outpatient protocol. Discussion: outpatient administration of tarlatamab is safe and feasible with appropriate monitoring. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X. That wraps up this segment of ConferenceHype's coverage. We'll be back with more source-attributed updates soon. Stay with us.